Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
What is the differential diagnosis of dementia? Okay, so first we will see what are the causes. What are the causes of reversible dementia? So, what are the different causes of reversible dementia first? Okay, reversible dementia can occur due to vitamin deficiencies like it can occur due to thiamine or vitamin B1 deficiency, which is actually presenting as wernicke's encephalopathy will result in vitamin deficiency, which is a reversible dementia, or vitamin B12 deficiency like pernicious anemia, or nicotinic acid deficiency like pellagra. All these are responsible for reversible dementia. Or there can be endocrine. Then the next cause is endocrine cause, or there can be endocrine failure or other organ failure like hypothyroidism or adrenal insufficiency or Cushing's syndrome or hypoparathyroidism. Not just hypoparathyroidism, even the hyperparathyroidism, renal failure or liver failure or pulmonary failure. Okay, all these are the endocrine causes of reversible dementia. Then alcoholism will also result in reversible dementia. Then if you see the psychiatric causes of reversible dementia, it can be due to depression. In depression, there is an entity called as pseudo dementia. Here, the patient truly do not have dementia, but the dementia is because of the depression, because the patient doesn't wanted to remember the futures, remember the things. Then there can be schizophrenia is seen. Okay, so this can also cause dementia. Then we have chronic infections can cause dementia, like if the patient has neurosyphilis or tuberculosis or fungal infections or protozoal infections or Whipple's disease. All these can result in dementia in the patient, that too reversible dementia in the patient. Then the patient can also have reversible dementia due to head trauma, and also diffuse brain damage can result in reversible dementia, especially in conditions like chronic subdural hematoma. In chronic subdural hematoma or hemorrhage can cause reversible dementia, or normal pressure hydrocephalus can cause reversible dementia. Then toxic disorders. Some of the toxic disorders can also result in reversible dementia, like intake of drugs or medications or narcotic poisoning can cause reversible dementia, or even heavy metal intoxication is associated with reversible dementia.
thank you and thank you for watching.